Hello and welcome to the Growing Healthy Families podcast. I'm your host, Dr. Scott Haggerty. On this show, I interview the world's top health experts so that you can know with certainty what it takes to give your family a life of epic health and wellness.
As parents, we don't want to see our kids struggle. I knew that he had the potential, and I knew that something needed to be done.
It was hard. We would get frustrated. We didn't know how to deal with it. I was more emotional about it.
Sure that, we're here. Amen to that, brother. Amen to that. Welcome to the Growing Healthy Families podcast. Moms and dads, I am so excited for you today because I have a special treat for you. Today we have Dr. Monika Buerger. So she is the owner of Eagle Canyon Wellness Center in Amman, Idaho. She is the founder of Intersect for Life. She is one of the world's foremost experts and authorities on neurodevelopmental disorders in children and in adults. And it is my pleasure, Dr. Buerger, to have you here on the podcast today. Thank you so much for being with us.
Oh, thank you for having me. I'm super excited, and I'm always willing to share our message.
Well, thank you so much. So, this is such a huge topic, and we see more and more children that are going down the road of being diagnosed with neurodevelopmental disorders. I find that many of the moms and dads that I speak with oftentimes are very confused by this. So would you mind discussing some of the common threads when moms and dads are going down this road that they may need to look for?
Absolutely. I've been in practice 29 years. I started down this road 25 years ago. Back then, we were concerned about things like ADD, ADHD. Autism really wasn't on the radar. So why are we seeing this phenomenal increase in those children with neurodevelopmental struggles and overall health struggles? What's going on? So what I've really started to do in the last couple of years was actually back the cart up. Rather than trying to be a trajectory and change that course once that little fiddle fart, that little human is on our planet here, it's harder. So what's going on preconception? So that's one thing I look at, because what we're seeing now is some common threads in preconception status of mom and dad. Their toxic load. And when we talk about stress, first of all, we need to define stress. A lot of people think stress is, I'm stressed out because of my job, I'm stressed out because of school and so forth. Stress is traumas, toxins, thoughts, technology now on the nervous system. There's an abundance of stressors on the nervous system. So one common thread we're seeing is that people of childbearing years are actually having trouble with conceiving, right? We're seeing fertility clinics pop up all over the place. Why, all of a sudden? Why is this happening? Well, we know that from science, from neuroscience, from neurophysiology, we understand now that parents, mom and dad's toxic stressor load is carried over into that little fiddle fart, into the fetus. Their emotional stress load is carried over. Certainly their chemical stress load. So those stressors will also prevent or can be a roadblock to conception. So we're seeing trouble with conception, maybe more miscarriages prior to that actual viable pregnancy. So I actually go back a generation or two and want to look at the health status of parents and grandparents. And you're going to see common threads there. Then baby enters this world. What are some common things we see? C-sections. In the United States, 1 out of 3 births are via C-section. We have a misconception there. We think, we're just going to unzip our mom, pull baby out, and it's a happy thing. There's a lot of stress that goes with that, a lot of factors we have to consider. We see early years chronic infections, particularly ear infections, and then the use of antibiotics. We also know we're very savvy now in the science world regards to the gut-brain and brain-gut axis. That is huge in neurodevelopment. So we'll see that, and then we'll tend to see lack of milestones, lack of motor milestones. It's really fun these days. We're seeing that fine and gross motor skill development. Baby bringing hands to midline, baby developing what we call the pincer grasp, baby stacking blocks. Those milestones, those gross and fine motor skills are actually very much associated with language acquisition and language development. So what do we see in those with neurodevelopmental challenges? We tend to see neurophysiological health issues, gut, immune compromise, allergies, eczema, asthma. It's kind of a whole picture we see. We see lack of fine and gross motor skills. And what else are we seeing? Lack of language development. And these all interact and tie together. So I look at the whole picture, and how many of these red flags show up in that specific individual.
It's great that you bring the entire picture together, because I think a lot of moms and dads really are looking for someone to go and tell them why this occurs, right? And for many moms and dads who are searching, they're asking every professional why, what happened, what led down this road. But I think oftentimes just not even understanding the way that the brain and the nervous system is built and the way that it's supposed to develop, right? Because what you talked about with, missing the milestones, I think it's important that moms and dads have an understanding that there's a very specific order in which the nervous system is supposed to develop, and then critical things that we need to see happening from the perspective of developmental motor milestones from the baby. Could you go into that and explain that to the viewers?
Absolutely. So to simplify it, we kind of develop from, I use this model as a brain, we kind of develop from bottom up. Okay. So so think about the spinal cord and the messages coming up via the spinal cord into the base of the brain, okay, into what we call the limbic system. This is your emotional drive, okay? So we have our reptilian brain, our primitive brain. That is one where it scans for threat, like animals do. Mm-hmm. If we get stuck in that lower part of the brain, that primitive brain, we're always scanning for threat. We can never be comfortable in our own skin. Well, what happens is then that leads us into a chronic fight or flight state. And the neurophysiological consequences from that is vast. We're going to have chronic gut dysbiosis or gut issues. We're going to tax out the immune system. So we're going to see those chronic infectious loads, the allergies, the eczema, the asthma, and so forth. Then we move up into the limbic part of the brain. This is our emotional center. This is really where we make all decisions in life. This is where a lot of the sensory input comes in. So from the outside world and from the bottom up, because we actually have 8 sensory systems. We don't just have 5, okay? A lot of people get stuck with those 5 senses: sight, sound, hearing, touch, smell, etc. But we have 3 very key senses that come from within the body. And those are going to really travel up the spine, the impulses from the spine up into the brain. And these are key systems. If it's all chaos coming into this limbic system, I'm stuck in what I call it limbic lock and load mode. I'm always in a fight or flight mechanism. I'm always on guard. If you are stressed out all the time, if you're always in a threat mode, you're afraid something's chasing you, like there's a tiger chasing you, how well can you learn? Mm-hmm. How well can you digest your food? Our physiology is such that if we're in a dangerous situation, we're not in what we call a rest and digest state. The gut becomes inflamed. The gut is the second brain. So now we've got this inflamed gut, which is an inflamed brain. So if we have chaos on those lower systems, this higher system, what we call the frontal lobe. The frontal lobe is analogous to right here, your fingers. It puts a brakes on all the chaos from those lower centers. It keeps it in check. Mm-hmm. That is our reasoning, our rational part of our brain, our decision maker. It's our impulse control. How many kids are out of control?
Oh my gosh, tons.
Right, they don't have impulse control. They don't have executive functioning. They don't know, they can't modulate themselves. They can't be reasonable and rational. So have you ever been in an argument with your significant other?
Never, no,
Right.
never ever have.
But have you tried to reason with somebody in the middle of a heated argument?
Yeah, it doesn't go very well.
It doesn't work well because this part of the brain is off center. It's done. So let's bring this back to neurodevelopment. How do we mature those higher, more sophisticated parts of our brain? Through doing, through movement. The brain learns, it develops through doing, through movement. And so that's why these motor milestones are so incredibly important, is that little fiddle fart is able to move through space, is able to get on their tummy, arch up, is able to belly crawl, creep on all fours, etc., to develop those patterns to stimulate those parts of the brain. And then the brain it can be whole brain, whole body learning and development.
You know, it's funny. I love that you put that all together because, you know, the developmental process is so critical. And one of the things that we talk about, even with our parents here all the time, is that, you know, if the brain is learning to be in stress, then the brain will only have stress output. And I think that's a great explanation in the way that you talked about that, because, you know, the concept of brain development, both normal and abnormal, you know, it has very distinctive features, doesn't it?
Absolutely. Absolutely. And we see these patterns. These are key questions we ask, but we put the whole picture together and we tend to see these global patterns. And you can see where there's what I refer to them like holes or missed stepping stones in the developmental process. And again, if that frontal lobe doesn't develop, this is a huge area in what we call fear extinguishing. There's a connection between that frontal part of the brain and that limbic system, this fear monger guy, okay? And by the age of early 20s, we should have this, what we call fear extension. That means that frontal lobe is fully developed and it can put the brakes on those lower stress response, fear parts of our brain. When that doesn't happen, then we constantly live in fear, stress, then the anxiety, the depression, so on and so forth starts to creep in.
So Dr. Buerger, you know, obviously in your practice, you see lots of kids coming in with these challenges. When you go through your assessment, and I know it's very unique and very comprehensive. So what are some of the techniques that you utilize to help a mom and dad to understand what's happening with their child's brain, but also more importantly, get down to where these missed milestones and where these developmental connections have been missed?
Well, you start with a very comprehensive history, and see if the parents can remember, did they do tummy time? Did they crawl on the belly? Did they creep on all fours? Did they bring their hands to the midline? Did they roll? Okay, so I ask key questions. But you'll also know from some of their presenting signs and symptoms, some of these patterns that may have holes in them, because from my aspect, we know the neurophysiology, where the breakdown is and how it presents in a child. But then I also do a very comprehensive sensorimotor evaluation. And I really want to hit on this one, because sensory processing disorder has been a big thing that has been out there for many years. I've been teaching that for over 25 years. But I think we need to clarify that. It needs to be sensory motor processing, because for all the sensory input into the brain, there needs to be appropriate motor response. Okay, that's very key. So I will look at how well they can perform specific motor tasks depending on that sensory input coming into the brain, and look for those deficits. Knowing what systems have the deficits, I know what I need to work in order to help mature various parts of the brain and the nervous system.
So, it's interesting because when you talk about sensory motor system, right, sensory motor processing issues, a lot of moms and dads don't get the connection between motor system and sensory system. How does movement alter the way the sensory information comes into the brain?
Oh, I love you. Okay, so this is where I could be here forever. So it's like a safety pin loop. Okay, we have to have sensory input into the CNS, into the brain. Okay, that comes again, it comes from the 5 outside senses, but it comes from 3 senses within the body. One is called the vestibular sense. The vestibular sense is the head honcho of regulating all sensory input into the CNS. That vestibular sense is large. The input is from all the joints in the spine and the muscles, but it's really big from the upper neck area, the inner ear, and it goes into the base of the cerebellum. It's the base of the brain, kind of down here. All right. So we have the vestibular system. That vestibular system is related to anxiety, depression, scoliosis, dyslexia, a number of issues. Then we have what we call proprioception. That comes from deep pressure from our joints and our muscles, especially the spine. It is very calming to the brain. It helps us screen out all the other unwanted chaos. So that comes from the internal structures. And then we have what we call interoception, or our neurovisceral. That comes from our organs, our viscera, our organs, our gut, our lungs, etc. And that is largely what we call vagal tone in our world. Okay, it's a big nerve. I call it the big bag voodoo daddy nerve. All right. So all this information comes into the brain. It has to be organized. When it's organized, it's like a dot-to-dot puzzle. All that information comes in. They all hook up together. They all talk to each other to create a picture, like a dot-to-dot puzzle does, right?
Mm-hmm.
If I gave you a dot-to-dot puzzle, but I didn't let you connect the dots, you wouldn't know what that picture is, right?
Oh, yeah.
All right. So if I ask you, hey, Doc, what's this a picture of, but I won't let you connect the dots, you're going to look at me and go, I don't know. And then I say, okay, what sound does this picture make? I don't know, because I don't know what the picture is. It's not connecting. If I let you connect the dots and you see that it's a puppy dog, and I say, what sound does that picture, what sound does it make? You can respond appropriately, right? You have a motor response. It says ruff, ruff. So if this information comes into the brain, it's all chaotic. They can't connect the dots. They can't respond with the correct motor output. What does that look like maybe? They're clumsy. They have poor fine or gross motor skills. They can't visually eye track. So reading comprehension, writing can be difficult. So for all the input coming into the brain, there is an output response. Now that output response sends more sensory input into the brain. If it's good sensory input, the brain can process it and have the correct motor output. And these systems reinforce themselves, either in a good pattern or a bad pattern.
Sounds like a lot of nerves wiring together and firing together, doesn't it?
Yep.
So moms and dads, if this is not a concept that you've heard before, what she just said is gold. Because everything the brain is built to do is to process and learn, fire and refire, fire and refire. And everything that we or our children experience in the world comes from processing information and then feeding forward or determining the next expression, the output, based upon the input. Did I say that correctly?
Absolutely. That's one of my favorite saying. Input has to equal output.
Yep. And so when we talk about kids that are having neuro struggles, right? And I think that you hit on a couple of gold points there. The process of information coming in, if it's not refined correctly, the output problems then become significant. But you talked about something that many moms and dads may not be aware of, interoception. And so I think that's a really important topic because especially with certain types of neurodevelopmental challenges, that's a huge, huge concern.
It's huge. It's huge because Okay, so now it goes back to the brain-gut-gut-brain connection. So much of this neuroception, this visceral information into the brain, about 80% of it comes from that big bad voodoo daddy nerve called the vagus nerve. That vagus nerve, that dude controls a lot of things. It controls our immune system. What do we tend to see as a paradigm picture? One of the red flags with these neurodevelopmental challenges, they have poor immune system function. It controls digestion. What do we see with these kids with neurodevelopmental struggles? Poor digestion. It controls heart rate. There's a thing called heart rate variability. Anyway, it can't adapt to stress. It's going to control our GI system, our gallbladder. It's just a big bad voodoo daddy nerve. So 80% of that visceral sensory input comes from that nerve. So it needs to be working properly. And about 80% of that information is what we call parasympathetic. The parasympathetic nervous system is the brake pedal of our body. It slows us down and balances us out a little bit. So if it's not working, we're constantly in that fight or flight threat mode, and the domino effect, like we talked about, will occur.
That's huge, because moms and dads, when you talk about gas versus brake pedal, right? If your child is dealing with a neurodevelopmental challenge, their nervous system is stuck on the gas pedal. Mm-hmm. That vagus nerve is built to be able to tap the brakes. One of the most important concepts, too, and we talk about this a lot in our office, is that the brain is wired so that you can't be in growth and protection at the same time. Mm-hmm. It's a balancing point. Mm-hmm. And so, when a mom and dad is coming in, right, what they've seen is the gas pedal mostly. Wouldn't you agree?
Yeah, absolutely. One thing that's happening more and more is I call it different zones of regulation. So when they're in gas pedal mode, I call it the red zone. Mm-hmm. They're anxious. They can be very explosive, very mean, very outlashing. The body can only sustain that for a certain amount of time. And then it says, okay, this is too much. This is too much for me. I'm crazy zone. I'm crazy brain. So it's going to drop down into what I call the yellow zone. It's just a freeze and dissociate. They're just kind of lights out. And that's when the child often becomes, especially in school and academic situations, when learning is too overwhelming because of poor sensory motor processing. Mm-hmm. They are overwhelmed. They go into red zone, overstimulated. And then the brain says, okay, this is too much for me. I got to survive this. I got to survive this treachery. I'm going to go into yellow zone, and I'm going to go lights out for a little while. And oftentimes what you'll see is the teacher, this is where like, Johnny, pay attention, get back on task. Hello. Okay. So they can bounce between red and yellow zone. And this oftentimes looks like a bipolar expression. So you're right. It's all about balance, but in appropriate manner.
Mm-hmm. And it's interesting because a lot of moms and dads, they're looking for ways to try and help with that specific behavior, right? Yeah. So the inability to maintain focus and attention and stay dialed in at school, right? And so what do most people now in today's modern society, what do they normally do for their kids to help with that?
Yeah.
They have to go to meds, right?
Yeah. And, we've got some profound, just in the last week, we've got some profound studies out on the severe adverse effects of some of these meds. One is, we've known for a while the increased suicide rate, but the studies are coming out even more fast and furious about the magnitude of increased suicide rates with those meds and cardiovascular events and other neurophysiological health issues. I just got a good one yesterday. So these are things we need to get to the why. Mm-hmm. Why is this happening? Not just patch it up. It's not just put a patch over it, because you put a patch over it, there still have these underlying neurophysiological stressors, and there is going to be a consequence. At some point, there's going to be a consequence. So
true, so true. And that's why I love the work that you're doing, because you're trying to intervene before children have to go down that road. Absolutely. Or kids who've gone down that road to try and help them to move the needle back in the other direction. And I'd love for you to talk with moms and dads that are watching this, so they can have an understanding of how what you are doing is able to change the equation for so many families?
That's a great question. Well, one of the things that we're doing in our Intersect for Life program is I'm getting ready in the next 3 to 6 months to launch a program called Developing Minds. Because again, it's changing that trajectory before it even happens. So I'm starting with what I call early intervention. And it's not the early intervention we're used to hearing in our paradigm today in schools, early intervention. It's preconception care. How are we going to get moms and dads healthier so that load doesn't carry over to that little fiddle fart? Then it's right from the get-go, what strategies can we put in place to optimize normal neurodevelopment? What does that look like? I call it the web of health. Chiropractic's the linchpin, right? It's the top of the pyramid, regulating that nervous system. That's just a given. But then I look at the immune, gut, endocrine, sensory systems. And then I also look at a lot of individualized biochemistry, what we call methylation biochemistry and mitochondria function. So I tie a lot of pieces together because it's like a three-legged stool. Mm-hmm. You work on one or two legs, but that third leg is still wiggly, not stable. What is it going to take till it topples over? We have no idea. What stressor is going to be the one to topple it over?
It's tremendous that you're really trying to get in front of the problem, right? Because the best place to start is before the problem has occurred.
Absolutely.
So Dr. Buerger, if a mom and dad who hears that you're developing this program, the Developing Minds program, and they're interested in learning more about this, where will they be able to go and find out more information, and how can they implement this in their own lives?
You can go to our website, which is intersectforlife.com. All our information is there. We've got a lot of fun programs rolling out. I'm also working with Dr. Heidi Hovick, one of the leading neuroscientists in our field, and we're putting together programs as well. So they'll be able to find all that information on our main website. And then we also are within the next week, we will be launching a doctor's database with all of those docs that have trained with the Intersect for Life program. And so they can, around the country, they can look if there's somebody in their area that can really work to tie all those pieces together.
That's tremendous. And moms and dads, for those of you who have viewed our podcast before, you've already seen Dr. Heidi Horvick and her tremendous work and her vast knowledge about the brain and the way that it works. So that is a magical partnership when you can put someone like Dr. Buerger and Dr. Horvick together to be able to go and create programs that help kids and families to have better starts. And to be able to go and train doctors so they can serve the world at a higher level. Because if this is something that you're struggling with, you need resources, right? And it's a huge thing where moms and dads oftentimes feel like they don't have the appropriate resources, or they're having to search in a million different directions. So what you're doing is you're really trying to put that all in one place, aren't you?
Yeah. Because these poor parents, they're going to this and this and this therapy and that, and it's really, you can't do piecemeal work with any human being. You can't. It is a whole complete system, and it's really understanding all those individual levels and how they interact together. Methylation biochemistry, some people get overwhelmed by it, but it has a huge, profound regulation over the visual and vestibular systems, two main sensory systems. So how does this all work together? And that's the fun part for me.
I think that's tremendous because, one of the things that we, in our own practice here, parents that we've talked to, that's always been a struggle is that they've always had to go in a million different places to get the resources. So by putting it in one place to be able to go and help those families, number one is simplify. To help them to go to one place, to one provider, to get the help they need for their kids, I think it's tremendous. So thank you so much for your work and what you're doing in being a leader and a teacher for this profession.
Hey, it's my what I call my passion and my mission, and together we're stronger, right?
Amen. And moms and dads, I think that what you've heard here today is a lot of gold, because if you have a child or a family member that is struggling with these types of challenges, I'm sure you've probably been looking. And I hope that after hearing from Dr. Buerger today, you realize that help's coming. That there are doctors that are getting trained to help children and families just like yours to have a better quality of life.
Absolutely.
So,
Amen.
Dr. Buerger, I thank you so much for the work that you're doing. And the website, again, is intersect4life.com.
Yep.
So, and there will be a provider directory coming, you said, in a week?
We're launching it as we speak. We're getting all the data in there, so it'll be there.
Oh, that's tremendous. And there may be some moms and dads that may want to work with you directly. So what would be the best way for them to reach you if they want to work with you directly?
That's a great question. I have people that fly in from all over. And then sometimes they'll do the initial eval with me, and then they'll work with one of the doctors in their area, or they stay here sometimes for several months. Our office number is area code 208-346-7763. We do have a waiting list because unfortunately, there's so many people struggling now. But best thing is to call that number and connect with us that way.
And we'll also have the phone number and all of your website addresses in the show notes. So moms and dads, when you're watching this, once you get done watching this, because I know that you're going to be moved, make sure that you go and check out those links. Also, we'll make sure that we have all the social media links, because I know they can follow you online, because you've got lots of great stuff on there as well. So moms and dads, just make sure that you take action, because the only way that you can start changing the course of your child's health and your family's life is to take strong, profound action and get the resources that you need.
Absolutely.
Dr. Buerger, thank you so much for being here with us today. It's been an absolute pleasure. And I'll make sure we get all that information posted, and we'll have to get you back on here again so we can teach more great stuff to these moms and dads. Would you be willing?
I would absolutely be willing. And thank you for doing what you're doing. Thank you for helping us change lives and change the future.
Thank you very much. It's completely our pleasure. It's our mission, and we are passionate. So
that's right. You got it.
You got it. So, all right. So thank you so much for being with us today. Moms and dads, God bless you guys. Thank you so much for being here. And make sure that you go and give us a review, rate the podcast. Make sure that you tell your friends and loved ones about this, because the whole point of this, everything that we're doing here, is the mission. Let's help moms and dads. Let's help families. Let's help our babies to have the best quality of life right from the very beginning. God bless you all, and be elite. Thank you for listening to the Growing Healthy Families podcast, the world's #1 source for health education. Make sure to go to iTunes or wherever you listen to podcasts and give us a review. Make sure to follow us on social media at the links listed in the show notes, and let us know what area of health you are struggling with, so we can get you and your family on the road to epic health.